Okay, let me go to who have got. Oh, sorry, Dr. Harry.
Thank you. I'm Paris Ngahu. A medical doctor who's also a skin specialist and a public health specialist. I have two comments and a question. First of all, I'd like to congratulate you on your eloquent presentation. It was really good. And I truly believe in your vision. I'm excited about the fact that you'd like to make community health volunteers to workers, because that will go in a long way in achieving the universal healthcare coverage. And there's also the fact that you'd like to focus on public health, which is a very good thing. So my question is actually on universal healthcare coverage that was initiated by the government of Kenya in 2018. They did pilots in 4 counties, and it wasn't successful. Even up to now, most individuals and most families cannot afford the NHIF payment, the monthly 500 shillings. So my question is, what would be your plan to strengthen universal healthcare, and what extra measures are you also going to take to fulfill your agenda of ease of healthcare for everyone?
Thank you very much, Dr. Ari. And indeed, public health will remain a priority. I'll not repeat what I said. But the Hospital Health Insurance Fund of Kenya is the most amazing thing that has happened from this government the last 10 years. I mean, just the effectiveness of NHIF has been wonderful. But we have something we need to improve. When I look at NHIF today, their biggest disbursements is going to private hospitals. There's something there that is a problem, and I can see corruption loud and clear. When I speak to bishops from different faith organizations, the Catholic faith, the PCA faith, who run hospitals, they are complaining their invoices are not being paid by NHIF. Public hospitals are also complaining that they are behind the curve in terms of being paid by NHIF. What is this that is incentivizing? You know, I'm an economist. We learned about Adam Smith. The dinner, you don't owe your dinner to the benevolence of the baker, the butcher, and the brewer. It is their self-interest. What interest is prevailing supreme in NHIF so that the people they are reimbursing fastest and quickest is private hospitals, not public hospitals or hospitals run by religious and faith institutions? We are going to deal with that NHIF straight and square. It's starting to get eaten up by corruption, and NHIF, we shall enable you by being a county that recruits as many people as possible. In fact, we have a vision and a goal and a pledge that if you have a single business permit in Nairobi, one of the things I said, we will use a single business permit as an incentive tool for minimum wage. It will also be an incentive tool for NHIF recruitment, including for house girls, house helps, or what we call domestic house managers. Give them NHIF, because if all of us contribute, then we have a tool. What I've spoken to is a barrier, so access to hospital insurance is key in the city of Nairobi. And it doesn't matter whether you're in formal employment or informal employment. We as a government will look for incentives. We have the mechanisms to be able to build that. But we will also want to ask the global NHIF, which is under the national government, to really look at it. Our hospitals, that cash that is going to private, and by the way, what I have said is factual.